All right, it is, sorry, we're about a minute late into our Monday morning or Monday afternoon news briefing. Thanks very much for joining us today. We're going to get started with one of our presenters first. Gerry Malais, who is the Emergency Services Manager, will be the first on our agenda today. He has a limited time and we only have him until 12:30. So we'll take both his information and questions for him before we go on to any of our other presenters. So thanks very much for joining us, Gerry. Can you give us an update on housing sites and testing sites?
I'll start with the testing sites. Other than the public health testing, I think what is new that everybody's interested in is the fact that the state of California is opening 86 testing sites around the state that are open to the public rather than the health department where you have to be symptomatic and someone has to refer you to that testing. So Monterey County was fortunate enough to get 2 of those testing sites. We're going to be opening them up one in Salinas at the Alisal High School and the other in Greenfield at the Greenfield Public Free Library. The library is going to open up tomorrow, and then the high school will open up Wednesday, and then subsequent weeks they will both be open from Tuesday through Saturday. The first 2 weeks we're trying to prioritize healthcare and first responders for testing. And then after that, starting on the 19th, it'll be open to the public. The registration is done either online or by calling the number that's posted. The health department was successful on creating a link on their website for Saturday, and we have been putting out public messaging since Saturday. That's the process there. There is no cost to the public. If you have insurance, that's covered in full, no deductible. And if you don't have insurance, then the state will basically pay your tab. The state has contracted with a company, a nationwide company that does this kind of thing all over the country, and they're very reliable. And they will be working with one of our local private labs to have the results in 36 to 48 hours. And then the person that gets tested will be notified by the company themselves. That's on the testing. The capacity is 132 tests per day. So maybe that's of interest. So moving on to the housing, as you all know, the county is a multi-pronged approach to our housing of patients that are at risk or symptomatic with COVID. So we have the fairgrounds, which is operational. We don't have anybody to put in it at this time. So we are not gonna open the fairgrounds for just 1 or 2 people. So we're waiting until there's an adequate number to make it worth the while, since it is a quite expensive option. We are still utilizing hotels around the county, as well as the trailers we have at San Lorenzo Park. We're trying to get another large facility similar to the fairgrounds at Sherwood Hall in Salinas. We have signed the contract with them, and that is moving forward. We should be operational in approximately a week. The other option is the Salinas Valley Fairgrounds, that we're still in the planning phase on that. We will not pull the trigger to make that operational until the capacity of the other sites that we have around the county comes into play a little more, where we're starting to fill up. So with that, is there any questions, Maya? I'm on my phone, so I can't see all the chat. There's a bunch of questions people are doing on chat. So if you want to read those off to me, I can answer them.
You already answered one that had come in, but an additional one came in regarding something you just said. What is the adequate number to open the alternative housing sites? And you were talking about the fairgrounds.
Well, you know, there's not a hard number. It really is going to just be the sense that the health department gets from um, uh, the increased need to house people. Obviously, our priority is to only house people at the fairgrounds from that are released from CHOMP. That was our commitment to the community leaders down there, unless the other facilities were at capacity, and that hasn't happened yet. And CHOMP has very few patients they're treating or releasing. So we're just going to wait until it looks like there's a greater need. So in the time being, we do have the hotel there in Moreno that we can put people at if CHOMP has an isolated patient or two.
Thank you. And another question, this may be more, and not just alternative housing sites, but in reference to the hotels that you just mentioned. How many occupants are currently in alternative housing sites?
I'm not sure if we're releasing that or not. So I have that number, but I'll reserve it until I verify with the health department if that's a number we're releasing. I don't know if that's meant to be public or not. There's a lot of HIPAA stuff that I got to be careful that I tread on.
Right, and that question came from the weekly, so Sarah, we'll get back to you on that, whether that number is releasable or not. And then Gerry, another question, when will the negotiations for the Marina Care site be finalized?
Okay, so the Marina Airport, I'm assuming is what you're referring to, is our alternate care site. And we're very happy with the progress that we're making on that. The negotiations are with the attorneys at this point. So the negotiations have basically finished. We just haven't actually signed the agreement yet, pending the legal ease that needs to go into these types of things. But keep in mind that we are not going to open or activate the alternate care site until the hospitals reach or get close to their capacity of patients, which at this present time, they're nowhere near. So again, just like the fairgrounds, an alternate care site is an extremely expensive project that while we have no problem doing it to service the public, if there's not a need for it, we don't want to open it and have it just sitting there vacant. The hospitals will dictate what patients come there, and will be basically an extension of their not only emergency rooms, but their hospital in general. So if they have still a good capacity, then we're not going to, pull the trigger to initiate that alternate care site.
All right. And can you also, for our next question, explain how the testing sites were located? The reporter indicates that Alisal seems to be appropriate since there are many cases in that area and North Salinas. Could you elaborate on the location process?
Well, the guidelines that we got from the state were that they needed to represent underserved populations. And so with the quantity of people that live in the Salinas area and the influx of agricultural workers in the South County, we just felt it was best to spread them the way we did in Greenfield and Salinas. So there's no science to it other than that. We just anticipate the need, and we were really trying to pick a spot that we didn't have to move because it was too hard to get to for some group or another.
All right, and those are all the questions that I have in the chat for you. Are there any questions for people on the phone for Gerry before he has to leave? All right, it's Gerry, you're off the hook.
Great, thank you.
Thank you. And then next, I see Dr. Moreno is on the line, and hopefully he is can turn on his camera and give us an update on public health.
Hey, Maya. Hi.
Great, there you are.
Hi. So, yeah, hello, everybody. So what have I got? So I'll try to keep it brief so people can leave time for questions. But we, as mentioned in the health officer order, we continue to have the new shelter-in-place order. We continue to have a stable number of new cases in Monterey County. For at least 4 weeks. And we don't, when we look at the epidemiologic curve, we don't see a logarithmic increase in cases, which means you go each day, the slope gets steeper and steeper. What we have is more of a steady increase in total number of cases as well. So those are all good news. And we also have, but that's limited to the number of the ability of testing and the number of testing that's done. So that doesn't tell us all the patients in people in Monterey County that have COVID-19, just the ones that were able to get tested. But another useful indicator is the number of hospitalizations for COVID. And we also have stable numbers of hospitalizations for COVID, which is the thought there is if someone gets COVID and they get very, very sick, one way or the other, they're gonna, almost all of them will wind up at the hospital, and the sickest ones will be hospitalized. And so if the number of hospitalized or the sickest patients in our county is steady for a period of time, that's a good indicator for our county. So those were a couple of the main reasons that I and other health officers in the area released some of the restrictions of the health officer order. So as far as specific data, our lead epidemiologist has continues to break up the demographics. If we meet the minimum criteria for each of the cells in our grouping, so we're now putting the numbers of and percentages, proportion of cases by zip code within some of the regions of Monterey County. So I invite you guys to take a look at that as well. And we are also looking at continue to post the number of tests, both positive and negative. And as a county, we've got about 3,500 tests conducted so far. But with this new OptumServe testing, it's estimated if we max out in 1 month, we'll have about 7,000 residents tested in 1 month's time just from that expanded service from Optum. So that's going to have a significant increase over what we currently have. But it's still a small percentage of the total population, but we'll gladly take it and use that information to guide further direction. Let's see, in terms of the indicators for further releasing restrictions, we continue to work with or meet with the state health officer and her team, and to provide recommendations to the state on what type of indicators would be required, and specific details of indicators would need to be met for further release of restrictions. So I think what most in discussions a lot of us agree on is a few things. One is, I already mentioned that there's a stable number of new cases and stable number of hospitalizations for COVID-19 in our county. And if we're, hopeful, we'll see a decrease. That would be one indicator. Keep in mind, as we significantly increase the percentage of people who are being, percentage of our total testing, we're going to see greater numbers of COVID-19. And these are people who otherwise, who will have COVID-19, but otherwise wouldn't have, excuse me, wouldn't have been diagnosed without the Optum services. So we'll have to look at, try to get some analysis to determine, as we have increased cases, what portion of that is due to just increased testing by itself, and what portion can we rely on to represent data that we can continue to use to trend how we're doing. Another indicator is that we have sufficient hospital bed capacity, and as already discussed just a few minutes ago, we are, through the Emergency Operations Center under Gerry's leadership, working with the hospitals and the alternative care site to increase the number of beds that we can house, so we know, and the number of patients that and beds that can be staffed. A third indicator that we've been talking about is that we need to have more testing, and right now we only have testing for virus, and so there's discussion still as to what proportion of the population do we need to be testing on average every day to give us reliable data on what proportion of the population is positive for COVID over time. So that's still being discussed. How much testing do we really need? And then at some point, antibody testing will be helpful, but we, as a state, we really don't have much in terms of that type of testing. There's still, the testing for antibodies is still unreliable in that it doesn't determine whether someone's immune to COVID. That information is gonna be more into the future. So it doesn't tell us who's immune to COVID-19. And many of these tests can't tell whether you've been exposed to one of the common coronaviruses that cause the common cold every year, or whether you were exposed to COVID-19. Some of these tests can't tell the difference. So for that reason, we're still focusing on the testing for viruses. Another indicator is whether or not we have enough capacity to do the contact tracing and the case and contact investigation and tracing. So we're still able to contact, I think, 96% of close contacts here in Monterey County, which is we're doing very well. That means that less than 4% of the people who are considered close contacts we're not able to get in touch with. And we've been doing, I think, working really well with the Emergency Operations Center and employers and the families of people who test positive to get the people who are in contacts into quarantine. And then the last thing is PPE. In addition to having adequate bed capacity, we have to have enough PPE. And so we do have, hospitals are reporting right now that they're doing okay with their supply of PPE under the current rates of hospitalization. But if we get into a surge, we'd have to determine based on how fast the PPE is being, as people say, burned or used and discarded, and would that decrease the supply of PPE for hospitals? So that we need to clarify that as well. So those are just a few ideas that my fellow health officers and I and state health officer have been talking about, and to some degree we'll probably see these type of indicators in the governor's future plans for releasing restrictions, and also local plans, because the locals may want to be more restrictive or may need to be more restrictive than the state or other counties based on their particular circumstances. So, and I would just add, I think, oh yeah, so we're also going to be looking at receiving some assistance from the state and assisting us in training additional staff in contact tracing. So we're looking forward to whatever the state can offer us. It would help us a lot because when we bring on new staff or reassign health department staff to do contact or case and contact investigations, we have to pull one or two of our staff away from actually doing those investigations to train other people. So if the state can help us with training or help us with staffing, we would very much appreciate it. So I'll go ahead and stop there, Maya.
Thank you very much, Dr. Moreno. Next on our agenda is Carl Holm. He is the director of our Resource Management Agency, and he's going to touch on some of the issues related to construction in the revised order. Hi, Carl.
Hi, good afternoon. So in the revised order, with the construction now is there's no restriction as far as construction. So we are able to issue permits, and we've been processing applications remotely with electronic submittals, electronic payments. We're going to continue that rather than opening the front counter. There will still be the electronic submittals, electronic payments. If people have hard copies, either to drop off or pick up, we have a drop box at Schilling Place. And people are able to put things in the box, we pick them up, we put them in the box, they pick them up. When it comes to the Appendix B, that's going to be on the inspectors. When they go out to the site, they will identify the person that is in charge of implementing the Appendix B for that construction site. And they will assess if they are in compliance with Appendix B. If that person is not on the site or they feel that they are not in compliance, the inspection will be canceled. And they'll have to reschedule until they are in compliance. So the inspectors will not be going into an environment that isn't in compliance with Appendix B. If there's a repeat offense to that, then there's potential enforcement that could include a red tag, meaning stopping the construction, or even potential fines. I think that kind of covers where we are, if there's anything from that.
Great, thank you. That you were just so succinct and brief. It's immediate.
I've had the weekend to think about
brief.
it. So, yeah.
Thank you very much, Carl. Please stand by for possibly some additional questions.
Okay.
And then our last presenter is, I see Maria Cuellar from our Child Support Services Department. She is the outreach manager, and she is going to give us an update on how that department is providing services during COVID-19. Maria, are you there? All right, I will try to get her back, but why don't we just then move on to, oh, Maria, is that you?
Yes.
Great, thanks for
having
joining
a bad...
us.
Hang on. Okay. Is that a bad connection?
You might want to turn down your other audio.
Okay, hang on. Oh,
Are you still with us? Why don't we give Maria a chance to work on her audio issues? She was our last presenter, so why don't we go ahead and open it up to questions. And I've got some questions on chat, which I'll go ahead and start with in the order in which they were received. My first question is for Dr. Moreno. Dr. Moreno, this question is a follow-up from the Friday briefing. You were asked whether you would require a COVID-19 vaccine before you would completely lift the shelter-in-place order. You said yes. To make sure we're clear, are you saying you would not lift the county shelter-in-place order in full until there was a vaccine for COVID-19?
Oh, so I apologize if I misspoke. So I think the point I'd like to make is that until there's a vaccine, there's still going to be a risk of exposure to the virus, particularly among vulnerable population. And what we're trying to do is to slow down. We've been able to slow down spread of vaccine to give our hospitals time to increase their capacity. We've been able to slow down to allow the private and public sectors to increase testing. And really we're trying to protect our hospitals, which I think we're doing so far, and protect our vulnerable population. But until there's a vaccine, our vulnerable population is still at risk for complications and dying. So I think we have to, looking forward, we'll continue to look at indicators for releasing, but the vaccine is so far out that I don't know that I could commit to anything with regards to releasing or not releasing. But it's going to be, it could be very challenging to completely go back to the way life was before if there's no vaccine and our vulnerable population are still susceptible to complications and death.
Thank you. And here's another question, and it does touch back into what you mentioned regarding additional testing in our area. Do we anticipate higher numbers of positive cases once these public testing sites get up and running? And you did indicate that that was a likelihood. Would that put us closer to the surge numbers that were projected for Monterey County?
I don't think that that's going to get us to the surge numbers in Orange, in our county. So when I'm looking at surge numbers, again, I'm looking at primarily for guiding hospitals. And what they're looking at is the number of hospitalizations, the number of ventilators, the number of ICU stays. And so that's really the part of the modeling that we're really focusing on. And so as we have more testing, we're going to identify people who don't have symptoms or have mild symptoms and are testing positive, but those aren't the ones that, a lot of those won't be being hospitalized. They're asymptomatic, and a lot of those people with mild symptoms, those mild symptoms resolve without going into serious illness. So what we're really looking at is, yes, increased number of testing, as I mentioned, but we still need testing more. Doesn't mean we're going to have more hospitalizations. Testing more means we're going to have a better idea of what proportion of the population at any given time is infected with the virus, and that can help guide future planning.
Hello? Good afternoon?
Maria?
Yes.
Maria, why don't you go ahead and give an update from Child Support Services?
Okay, very good. Okay, so our office, Child Support Services, is still open to the public Monday through Friday from 7 a.m. to 5 p.m. We have staff members that are in the office to assist, and it's close to 50-50. We have 46 in the office and about 42 teleworking or out of the office. We are practicing social distancing in regards to masks, hourly cleaning, 6 feet rule, and hand sanitizer available throughout the building. We have a call center number. It's toll free, 866-901-3212. Again, that's 866-901-3212. And our website address where customers can use to send emails is mcdcss@co.monterey.ca.us, or on our website at mcdcss.org. They can click on Contact Us and then click on Customer Connect. And these emails are read daily by designated staff for follow-up. In regard to the court process, the majority of the cases are being continued, but some are being heard telephonically. Discussions are underway about opening up courtrooms with limited cases. And that's my update. Thank you.
Thank you, Maria. Thanks for jumping in there and giving us your report. Let's go back, if we could, to questions for Carl Holm on reopening county parks. Carl, are you with us still?
Yes, ma'am.
Great. So the question is, why not reopen county parks at the same time as the revised shelter in place order and the rationale for doing so? And does this have anything to do with approaching holidays, which could bring large numbers of people to the parks?
At this point, the parks are what I would consider a soft closure, meaning that facilities like picnic areas, where there would be gatherings, play equipment that would need to be regularly cleaned, those areas are still closed off. But people can still get into the parks and utilize the trails, and they're allowed to do that. So it's similar to what BLM and Point Lobos is doing, where they've closed the parking areas, but people are still able to go in and use the trails. Each park is a little bit different. They offer different things, and so like San Lorenzo Park, where we do have the trailers, that area has been closed off, but it's also been sectioned off with fencing. If people want to use the trails along the Salinas River and go for a walk, they can do that. Again, it's just more the typical types of areas of facilities or where people might gather is still not open under the orders. So we have it functioning and operating in a way that is compliant with the orders for people can go out and use the trails.
Thank you, Carl. Here's a question for Dr. Moreno. Are local golf courses able to make reservations from out-of-town guests? And if so, how does that square against the efforts to discourage visitors during shelter in place?
Yeah, thanks for the question. I think someone asked me that last time. I didn't have an answer, and it's on my list of things to clarify. So I apologize. Don't have yet had a chance to address that.
All right, and so I'll note that to respond back. Thank you. Here's another question for you, though, Dr. Moreno. Could you please add some insight as to why the numbers are higher in Salinas in the east and northern ends?
Sure. So let's see. Just give me a minute here, if you don't mind. Okay. We've known that the NMC or SVMH and NMC have been swabbing more patients for COVID-19 than CHOP and Me Memorial. So as they submit more tests, they're going to, on people who are hospitalized, potentially being hospitalized, and people who are have fewer symptoms or mild symptoms. And as they test people who have mild symptoms who are healthcare workers and first responders, for example, we're going to find more people. So the more you test, the more you find. Kind of like when Optum comes in, we're going to be testing a lot more people. We're going to find more people. So so those two hospitals have been submitting the most tests. So we would expect to have more people identified in the Salinas area. And so we expect to have more, a higher percentage of Salinas being positive because of those hospitals than the percentage of the proportion of the entire population that Salinas makes up. And so that's I believe the primary reason for now. And again, we're limited by some data or lack of some data, but that's our epidemiologists for now statement that it partly explains for the increased percentage.
Thank you. And yeah, I have a question here that goes back to your when you were talking about contact tracing. How many people have been contacted to self-quarantine up to now? Do you have figures available? Dr. Moreno?
It's I think it's around 1,200 contacts, and 96% of those we've made contact with. I'm sorry. Yeah. So 96% of about 1,200 people.
All right. And another question for you, just an overall question regarding the shelter in place. This order is taking an obviously devastating toll, not only economically, but emotionally. People are out of work and not earning money. They can't pay rent and are frustrated and depressed. Is the county health department seeing more people in Monterey County with mental health issues related to the shelter in place order? And what, if anything, is the health department doing to help county residents who are stressed and depressed because of this order? And if our health public information officer is on, she may be able to also answer some of these questions.
Okay, well, so this is Ed. So I think the answer to that question is confirmation. First, confirmation that both the pandemic and people's fear of the pandemic and people's loss of family members to this virus is disruptive, and the shelter-in-place restrictions are as well. So what we continue to do is try to minimize the amount of injury and death from this pandemic with the minimum amount of restrictions on people's livelihoods to overall hopefully achieve the minimum overall impact on our communities. Specifically, the question about mental and behavioral health impact, I think I'd have to, I can't speak for our mental health director. I'd have to defer to her.
Right, and that question came from the Pine Cone, and Kelly, we'll get you connected with our folks at Behavioral Health who may have some additional information on what you were asking about. So Dr. Moreno, this question is for you. What kind of planning is underway for the next phase of reopening, and who would be involved at the county and local government level, and what are guidelines for doing so?
So the plans right now are not plans. The activities that are going on right now, as I mentioned, are the discussions with the state health officer, Dr. Angel, and our colleagues, our county health directors and our county health officers. So that's still ongoing. The who would be involved besides directors and health officers, we work closely with our epidemiologists. We work closely with and get input on certain parts of the restrictions with Mr. Carl Holm and RMA on the construction. We also receive recommendations from some of the different sectors from who are offering suggestions on how they can thoughtfully put together criteria that would allow them to allow workers to come back to work while minimizing the risk of exposure. And we continue to work with the Ag Commissioner and a variety of advocacy groups on how to protect ag workers, minimize the number of exposures and people who come down sick, minimize the number of people who need to be quarantined. So we have as many people as possible working in one of the most important sectors of our county community as possible. So that's basically how we're moving forward. And I've already mentioned gave some examples of the indicators that we'll be following and working closely with the State Department of Public Health to arrive at more details with some time.
Thank you, Dr. Moreno. And I have a question here regarding our face covering order and enforcement. How is the face covering order being enforced, and how successful has compliance been? We don't have anyone from the sheriff's office on our call today, and I'm not sure if anyone can give a complete answer, but if no one can, we'll forward that question to the sheriff's office and get that information for you. But I see Charles McKee has just popped up.
Oh, okay.
Well, I don't know if Dr. Moreno has more to add. I wasn't sure of this beginning of that question, just about where we are with enforcement, I think is what I heard.
Correct.
And my understanding is that there's been a pretty overwhelmingly positive response in compliance with both the shelter-in-place order as well as the facial covering orders and the other ones. And so there haven't been a great number of compliance issues for enforcement that we've become aware of. I know there have been pockets, both with some of the city police departments, as well as both environmental health and then the county sheriff, but the overall majority has been pretty positive. A lot of that has to do with what the way they're approaching it is generally with education first, and the hard enforcement is kind of the last resort.
Dr. Moreno, do you want to add anything to that?
Yeah, I'd like to. I just also want to share that as revised shelter-in-place orders come out, with the release of the face covering order, and our environmental health director has worked with me on guidance for outreach and education of regulated businesses. So our environmental health inspectors have been visiting each and every one of the food facilities in the entire county, and because that's part of their routine inspections. So anyone that's still serving food, and we're inspecting and also educating the management and employees on proper face covering to make sure that employees aren't employees and customers aren't exposing each other through drive-up windows and or at pickup in front of the store, the business, and that the employees are not necessarily exposing each other in what are often tight quarters in some of these restaurants. So environmental health has also helped out quite a bit.
Thank you. And another question regarding shelter in place. What kind of businesses and activities could be reopened under a subsequent shelter in place order?
Right. So that's something that we're still working with the Department of Public Health on. And when I say we, it's the health directors and health officers, and looking at if we on the indicators and detailed thresholds for those indicators, and then assessing what the risk, what each sector that's currently under restrictions, what risk level of risk do they pose if we were to release restrictions with or without criteria for opening up. So that's something we're still in conversations about.
Thank you. And here's a follow-up question on contact tracing. You talked about getting additional staff. How many additional staff members do you need to help with contact tracing?
Right now, we're able to, I don't know how many more we have, but we do have some folks identified. And we're going to, so right now we're able to keep up with the number of contacts. But as we do more tests, or as Optum does more testing, we're going to need to increase staffing. So we're working with the, as I mentioned, with California Department of Public Health to find ways in which they can assist us with training and possibly staffing. But in the health department, as needed, we will, as we anticipate more cases and contacts, we are looking at additional staff that can move over and be trained and assume. So I don't have a number for you, but we've since this started, since we had our first case, we've been able to fortunately reach almost all of our contacts, and we've reached all of our cases to get them into isolation.
Thank you. And continuing questions on the contact tracing. I think you may have answered this, but this entire question asked for a little bit more information. How many people have been located via contact tracing and advised to self-quarantine to date, and how many currently? Additionally, how many of the people identified via contact tracing have been tested, and how many have tested positive for COVID-19?
So the currently, or since the the COVID, since our first confirmed case, excuse me, we haven't had sufficient testing to test everyone who's a contact, and so we've had to focus on people who have symptoms or mild symptoms, and prioritize those in law enforcement, first responders, and also healthcare workers. So we work with the people who are close contacts and who are in quarantine, and if any of them develop fever or symptoms suggestive of COVID-19, then those are the individuals that are that we try to get in to testing. So that's I don't have a number of what percentage of or numbers of people that were contacts who developed symptoms, or the number of people who were contacts who developed symptoms, and of those, how many were tested. I don't know that I have that. I have to check with our epidemiologist.
Thank you. And then I have a question for Carl Holm regarding construction. Are there any limitations on the types of construction that can go forward from this point as long as construction safety protocols are adhered to?
As long as the construction safety protocols in place, there is no restriction on construction. There isn't any differential between essential or any other type of construction at this point.
All right, thank you. And back to Dr. Moreno, when might the new CHIME modeling be done, and will you release the results publicly, including projected number of deaths and under higher levels of shelter-in-place compliance than 70%?
I'm sorry, read that again.
Sure. When might new CHIME modeling be done, and would you release the results publicly, and perhaps including projected numbers of deaths and under higher levels of shelter-in-place compliance than 70%?
Okay, so yeah, thanks. So yeah, our epidemiologists are still trying to generate initial reports of new projections. It's very important that we do that and share that with the hospitals, and then so they can get an idea of how much more time they have until the surge, and what that surge might look like. And all I can say is we'll take one step at a time and start with informing the hospitals.
All right, thank you. Then additionally, I've got another question for you, which I'll take this since I've got you. Are you suggesting Salinas Valley Memorial and Natividad are using different testing standards or criteria than Community Hospital and Me Memorial?
Thank you. All the hospitals have the same guidance on prioritizing patients. Fortunately, our public health laboratory and the commercial labs like Quest, LabCorp, and the hospitals now with the new testing are able to test people who are lower priority, people who have mild symptoms, and anyone who's a first responder and healthcare worker. In addition, there's I think a willingness of us to work with the hospital to let them know whether we have more, can test more. So we've been able to convey to them that even though we can do 80 to 120 tests a day in our laboratory, if we're not testing near our capacity, then we let them know that they can go ahead and start testing more people. If for some reason we and Optum and the commercial labs were to suddenly have a short supply of testing materials, then we may have to be more restrictive on the to just the highest priority testing at hospitals. But my hope is that's not going to happen. I'm hoping that we as a nation continue to increase capacity in Monterey County and throughout the U.S.
Thank you, Dr. Moreno. And I have some questions regarding county parks and the status of county parks. And I'm hoping that Carl might still be on the call to talk about the status of the parks and whether the status of the trails that people can use.
Status in what way? The trails are accessible and open to access. So the soft closure went into effect after we had the hard closure for Easter. After that, I looked at each park independently as far as what types of things were in the park. And then trails were part of that soft opening that occurred just after the Easter weekend, after I talked with Dr. Moreno about whether or not it was within compliance of the order. Other than that, the trails have been open. The past couple of weekends with the nicer weather, we've seen a lot more activity. So we did bring rangers up north to help patrol, to make sure everybody was following the guidelines for proper spacing and making sure that there weren't gatherings and other things like that.
Thank you, Carl. And I have another question for Dr. Moreno, and I know this is a question regarding our latest COVID-19 victim, and they're asking for additional information or information about the 6th victim. And I was thinking this might be a good time just to reiterate why the health department releases limited information regarding COVID-19 victims.
Thank you. I don't have any information about this particular death, and the reason we don't release much information is because in the practice of public health, we need to maintain enough trust in the community that family members of people who have died will continue to work with us to identify everyone that might have been exposed. It's very, as you can imagine, it's a very, very difficult time for a family to be making arrangements for someone who's passed away, while at the same time there's an urgency to quarantine people that person might have exposed in a workplace or in the home. So it's very, very challenging for the families. And so we don't provide information that could reveal who the person who passed away, because it only adds to the stress and that the family is experiencing. So out of respect, and because we don't want people to find out who they are, we don't share that information.
Thank you. And Mark Carbonaro has had his hand up, and I'll go ahead and let him ask a question.
Thanks very much, Maya. Dr. Moreno, actually a couple things for you. One, in looking at businesses that are reopening today and some that are still closed, on the reopening side, why wouldn't coin-operated car washes be among those that are allowed to reopen, as they, people tend to drive into a shelter, you put your coins in the machine, you grab the wand and you wash your car, you're distanced from anybody else that might be there. It's not like, say, the other type of car washes where there are 5 or 6 people working on your car in close proximity and customers sitting in a lounge rubbing elbows. So that's one question. And then another question I had from a listener said that, were you aware that Sheriff Bernal said that he is not going to enforce the order of people, being out in public as chief law enforcement officer of the county during time of emergency. And he said that to former Sheriff Kanalakis in a conversation they had last week. And Sheriff Kanalakis shared that information on a broadcast over the weekend. So those are just a couple things for you.
Dr. Moreno?
Thank you. So as far as car washes, I'm still concerned that even though social distancing could be maintained, we've got people one after another using shared equipment, which is the hoses and anything else that they're touching.
That's similar to gas stations though, right?
Right, but the difference is one is essential, one's less essential. So gas transportation is essential. We as health officers recognize that. And so the support to allow for allowed transportation, which includes gas stations, must also be there. So that's when it comes to gas stations, the risk of exposure from contaminated surfaces from people touching the touchpads and swiping their cards, and that is a necessary risk in order to maintain a maximum benefit to our community to still be able to go grocery shopping and go to doctor's appointments. The car washes share a similar risk, I believe, where people are one after another contacting surfaces that could have COVID virus on them. And the car wash itself is not as considered essential. And so for that reason, the benefit doesn't, at this time, I don't believe the benefit outweighs the risk like we have with gas stations.
Thank you. And before we end, Adriana has been waiting to ask a question, and I'd like to give her a chance.
Thank you, Maya. Let me just have a little. Dr. Moreno, do you think it's possible that we can see you because I'm going to be recording you on camera?
Hold on.
Okay, so my question is the following. Is it true that 52% of the cases in Monterey County, the people live in East and North Monterey County? And are you working with other agencies, perhaps for information to that type of residents? Or what kind of education techniques are you using for the East Salinas residents? Thank you.
Sure, Adriana. So you're asking about more information about Salinas residents that test positive? I'm sorry.
Yes.
Well, at this time, it's basically the only information that my epidemiologists have on that group is that we're able to share to partially explain why there's an increased percentages is basically the number of testing. And so SCMH has submitted the most tests in the county, and NMC the second. So two hospitals, each of them testing more than the other hospitals in the county results in more cases being identified. So we would expect to have more cases in the Salinas area.
But my question, are you working with agencies like community building healthy communities to try to educate the community about all the risks involved in the virus?
Risks. So we're working closely with our public information officer and Charles McKee to engage as many advocacy groups as possible. There are some work groups that we're a part of that engage on a regular basis and meet serving the social needs of Salinas and farm working families. So yeah, there's a variety of agencies that we're working at, and maybe Charles might want to share a little bit of that outreach that we're doing in the county.
All right, and
sorry.
Adriana, oh, Charles, you there?
Well, I missed the beginning. I missed the question. Sorry, I was working on something else.
The question is that 52% of the residents in Monterey County live in North and East Salinas? And what are you doing to mitigate the number and education, especially East Salinas residents?
Charles, that's a little different question. So what are we trying to do to mitigate the number, or what are we trying to do? So what we're doing to mitigate the number of residents in Salinas is case and contact investigations, containment of the virus, and mitigations such as face coverings and shelter in place. So, I mean, that's, to answer your question, that's what we're doing to mitigate the number of cases. But I think the other question you had was, what are we doing to educate the community on the dangers of COVID-19? And
Correct.
Charles, I had mentioned that we have some work groups in place already that have brought together advocacy groups and social service type of providers to this community.
Yeah, thank you, Doctor. We primarily have been working with the agricultural community and the hospitals to bring the messages out to the workers in the field and in the packing facilities, so that they can kind of hear it from the professionals about the risks and also the best ways to protect themselves from COVID-19. The public service announcements that we've been pushing out through both radio and TV, and I don't know about the print media, but the radio and TV have kind of been a secondary way of getting the messages out to the broader community. The specific focus right now has been on the agricultural community with some of those educational efforts. I think as we go forward, we're going to have to look at some alternative approaches to getting to the different sectors of our economy that are reopening. And they're not going to be just solely concentrated in the Salinas area, but we recognize that the big part of the agricultural community is concentrated in the Salinas area. That's why we focus there first.
Thank you both very much. And sorry, we're a little bit over our time, but I wanted to let everybody wrap up their questions for today. Thank you for joining us. Our next media briefing will be on Wednesday, and we'll see you then.